Now for part 2 of Health, Genes, and Family History, where we focus more closely on how genes affect health. We'll discuss chromosomal disorders. We'll also look at a few gene disorders and discuss the difference between dominant and recessive gene disorders. And remember that genes are pieces of the chromosome. We'll look at dominant and recessive sex-linked disorders. These are found primarily on the X chromosome. We'll talk about how genes and environment are involved in the development of complex polygenic conditions. And we'll look at inheriting cancer risk and discuss oncogenes and tumor suppressor genes. Chromosomal disorders include Down syndrome, in which there is an extra copy of chromosome number 21. This young child has Down syndrome. And if we look at this genetic map, you can see each pair of the chromosomes, of our 21 chromosomes, plus the sex chromosomes. In this case, we have 2 X chromosomes. Chromosome number 21, there are 3 copies, and that leads to the condition known as Down syndrome. Turner syndrome, in which there is a complete or partial absence of an X chromosome. This is a condition that affects females, and they tend to be underdeveloped physically, they may be short, and they may suffer from heart defects. Klinefelter syndrome is a double XY condition. This affects males because having a Y chromosome indicates that we've got a male. And they tend to have female characteristics. They tend to be sterile. Triple X syndrome, there are 3 copies of the X chromosome. There tend to be very few physical issues other than early menopause. There may be some learning issues. And then we have what's called trisomy, in which there are 3 copies of every chromosome. This condition is fatal. We will discuss 2 categories of gene disorders, autosomal dominant and autosomal recessive. In autosomal dominant disorders, we call the defective gene a dominant gene. A single copy is sufficient to cause the disease in carriers. Autosomal dominant conditions include porphyria, which is a blood disorder, some types of dwarfism, and one that we'll talk about in class, and I ask you to listen to a podcast about it, is Huntington's disease, which involves a degeneration of the nervous system and early dementia. In autosomal recessive gene disorders, 2 copies of the mutated gene are required to produce the disease in males and females. This diagram are parents, each of them who are carriers. They themselves are not expressing the condition because it is a recessive condition. And if you look at the bottom, you can see that the average chance of having a child inheriting both mutated genes is 1 out of 4. We have a normal male, a carrier female, a carrier male, and an affected female. In autosomal recessive disorders, 2 copies of the mutated gene are required to produce the condition. Most of these conditions are rare conditions, again because 2 copies are needed in order to cause the disorder. Examples include Tay-Sachs disease, which involves chromosome number 15, and cystic fibrosis, which involves chromosome number 17. One that you may have heard more about is sickle cell anemia. This particular condition is carried on chromosome number 11. When a person inherits 1 copy of the mutated gene, they're said to have sickle cell trait. This appears to confer an evolutionary advantage in that the person inheriting the trait is protected against malaria. There's something about having this mutated chromosome that prevents the malaria parasite from getting into the red blood cell. Two copies of the gene result in sickle cell anemia, in which the red blood cell is malformed in this sickle shape. And among other things, these cells that are sickle-shaped clog capillaries, and this can be an extremely painful condition. Sex-linked disorders are also known as X-linked disorders. These involve the sex chromosomes. There are X-linked recessive disorders, in which one copy of the defective gene is sufficient to cause the disease in males, but two copies are needed for the condition to occur in females. And we also have what are called X-linked dominant disorders, in which the dominant gene is carried on the X chromosome. With X-linked recessive disorders, males only need one copy of the gene to show the effect. Females with one copy of the gene will be carriers because the other X chromosome protects them against expressing the condition. Examples of X-linked recessive disorders include hemophilia and colorblindness. X-linked dominant disorders are much less common, probably because they are lethal in males and do not tend to appear in the population. Complex polygenic gene defects involve a disease resulting from multiple genes interacting with environmental effects that result in a disease. And environmental effects include age, they may include head injury, or lifestyle. Examples of complex polygenic gene defects include type 2 diabetes and Alzheimer's. Let's talk a bit about inheriting cancer risk. The strength of the genetic link varies. We looked at identical twins. If one identical twin gets cancer, only 15% of second twins have been shown to get the same cancer. While this doesn't sound like much, it's still 5 times greater than the normal risk for inheriting cancer. Cancers with a strong genetic link include colon and prostate cancer and breast and ovarian cancer. The link is much stronger if the person is carrying the mutated form of the BRCA1 and 2 genes, which we'll talk about shortly. Cancers that have a weak genetic link include lung cancer and most other cancers. It's a relatively weak genetic link that has a strong environmental component, and I'm sure you can figure out what that strong environmental component is. Tumor suppressor genes suppress cell growth. They act like the brakes. Oh, and I spelled that wrong. Let me fix that. They act like the brakes on a car. They're involved in preventing the steps in the pathway of development that leads to cancer tumors. So they put the brakes on those cell division pathways. Some mutant varieties of the BRCA1 and 2 gene will produce shorter proteins, though, that don't protect as well. And people who inherit the mutated varieties of these genes are the ones that inherit increased cancer risk. So what I want you to understand is we all have the BRCA1 and 2 genes, but it's the mutated form of these genes that are associated with an 80% increase in breast cancer and a 40% increase in ovarian cancer by the age of 70. These mutations are commonly found in Jews of East European heritage, and there are blood tests available that can look for these mutations. We'll talk about some of the decisions that people may make when they find that they have these mutated genes. The other type of cancer gene is called an oncogene. The oncogene, well, we can say they're the opposite of the suppressor gene. Whereas a tumor suppressor gene suppresses growth, we say it acts as the brakes, the oncogene is like stomping on the gas pedal. It speeds things up. But we start with what's called a proto-oncogene. These type of genes are involved in cell growth. They tend to be normal genes, but they're vulnerable to damage, and that damage can lead to cancer. Usually, several mutations are needed in order to convert a proto-oncogene into an oncogene. Once an oncogene has been formed, once this damaged gene has been created, it is now ready to cause cancer because it is upregulating the process that leads to the growth of cells. That's what we call stomping on the gas pedal. You tend to only need one copy of an oncogene in order to be at increased risk for cancer. And some oncogenes can be inherited in an already damaged form. That's a lot of information, and we will certainly go over it in class as we finish this topic. I do want you to listen to the podcasts that are on Blackboard. And in addition to reviewing these topics, we'll talk about genes and the psyche, genetic screening, gene therapy, and the homework assignment. Class discussions will include, well, if you tested positive for Huntington's, do you think you should have children? If you or someone you loved inherited the BRCA gene in its defected form, would you have a prophylactic mastectomy, or would you want them to have a prophylactic mastectomy? These are things that we'll talk about in class. Thank you.